This presentation will focus on blood product management and transfusion strategies when caring for patients with acute upper GI bleeding. While several landmark papers have been identified regarding the management of upper GI bleeding, these two papers in particular examine transfusion strategies looking at restrictive versus more liberal protocols. In this East Minute, we will focus on the paper by J. et al., published in Lancet in 2015. Please consider watching our other East Minute on this topic, which covers the paper by Villanueva et al., published in the New England Journal of Medicine in 2013. The next paper to discuss is titled Restrictive versus Liberal Blood Transfusion for Upper Gastrointestinal Bleeding. This was published in Lancet in 2015 by J. et al. And is a subset of the TRIGGER trial or Transfusion in Gastrointestinal Bleeding trial. This is a multi-center, open-label, randomized feasibility trial completed in the United Kingdom. The trial compares two different red blood cell transfusion strategies in patients admitted with acute upper GI bleeding. As this was a feasibility trial, there is no sample size calculation. This initial trial was run from September of 2012 to March of 2013 and included 6 academic centers in the United Kingdom. All centers were large with more than 400 beds and high volume in terms of admissions per month for upper GI bleed. Centers were randomly allocated to one of the two transfusion policies, and all eligible patients in a center were treated according to the allocated transfusion policy. The trial aimed to assess whether a restrictive or liberal red blood cell transfusion policy for upper gastrointestinal bleeding in routine clinical practice is feasible and safe to implement through a cluster randomization. Patient inclusion criteria included age greater than 18, having presented to the hospital with acute upper GI bleeding. This was defined as passage of hematemesis or melena. There was no upper age limit for inclusion. Patients were excluded from this trial if the clinician determined a need for immediate blood transfusion secondary to the severity of bleeding, or if the patient was a hospitalized patient who developed acute upper GI bleeding. The figure provided details the enrollment process. Ultimately, 6 clusters were randomized with 2 study groups. This included 936 patients presenting with severe acute upper GI bleeding. 403 patients were randomized to the restrictive arm. These patients were transfused when hemoglobin was documented to be less than or equal to 8, with a goal hemoglobin of 8.1 to 10. 533 patients were randomized to the liberal arm. These patients underwent transfusion when hemoglobin was documented to be less than or equal to 10, with a goal hemoglobin of 10.1 to 12. The number of red blood cell units transfused and the timing of repeat hemoglobin measurement was determined by the clinician. A number of outcomes were identified by the study team. These included both feasibility and clinical outcomes, as you can see here. Protocol adherence was higher in the restrictive group when compared to the liberal group. It should be noted that the study previously presented, done by the group in Barcelona, was published during the enrollment period for this trial. Transfusion of at least 1 unit of packed red blood cells was equivalent between the two groups. Mean number of units transfused was equivalent between the two groups, and there was no difference between the groups in regards to hemoglobin over time. There are several limitations to this study. The first is that this was a feasibility trial performed in preparation for a broader trial. Thus, the groups were not necessarily balanced in regards to pre-existing comorbidities. Consequently, there was an increased identification of bleeding varices in the liberal group. The authors report overall feasibility of this study and implementation of hospital-wide transfusion policies. Additionally, they report non-significant reduction in blood use and separation in hemoglobin concentration. Thank you for your interest in this topic. This feasibility trial examined the implementation of a hospital-wide transfusion policy for upper gastrointestinal bleeding, looking at a restrictive versus more liberal policy in preparation for a larger trial. The team found non-significant reduction in blood use and separation in hemoglobin concentration. We'll have to wait for the results from the larger multi-center trigger trial before a permanent practice change can be recommended.